Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. More residents in Ondo State receive Moderna and Pfizer boosters as others vaccinate to stop COVID-19 spread. Taraba State government asks hesitant residents to come out for vaccinations in the best interest of their health. And thousands of nurses in Australia go on strike as COVID-19 cases rise. Thank you for joining us. The Nigeria Center for Disease Control has reported a backlog of 18 confirmed cases and a single discharge case reported for Akwa Ibom State from February the 7th to the 13th, 2022. This is after announcing more cases of COVID-19 in Nigeria on Monday. The infections were recorded across 8 states of the Federation with no fatalities. Here's more on the pandemic update.
75 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 8 states, indicating an increase from figures reported earlier. Lagos accounted for the highest number of cases with 28 infections. Akwa Ibom had 18, Ondo 10, Cross River 9, Rivers 6, Edo 2, while Delta and Kano states logged 1 case each. The total confirmed cases in Nigeria now stands at 254,091. The report also includes a backlog of confirmed cases and recoveries from Akwa Ibom State, as well as 0 cases from Abia, Bauchi, Ekiti, Ogun, Osun, Oyo, Nasarawa, and Sokoto states. 60 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 230,457. There was no additional death recorded in the last 24 hours, leaving the fatality toll at 3,141. Currently, there are over 20,000 active cases in Nigeria, while more than 4.2 million samples have been tested so far. Lagos State accounts for the highest number of cases on admission, with over 17,000 positive samples, followed by Benue and Nasarawa states. Over 16.6 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while more than 7 million of the population have been fully vaccinated. In Africa, over 11 million persons have tested positive, while over 244,000 deaths have been recorded across countries on the continent. The total global confirmed cases have surpassed 413 million, while deaths are now beyond 5.8 million.
And more clients in Ondo State have received their booster doses of COVID-19, including the Pfizer and Moderna. According to the National Primary Healthcare Development Agency, Ondo State has administered a total of over 2,600 booster doses. The Permanent Secretary of Ondo State Primary Healthcare Development Agency, Dr. Francis Akambiamu, also disclosed in Akure that so far more residents are turning up for vaccination.
Ondo State have vaccinated over 600,000 of its population, and that's a good number. That means those that have taken first, second, and third dose who have gone over 600,000 as of today, and that is a large number. And the part of that is that the mortality coming from COVID-19 have reduced in Ondo State and many other states where you have high vaccination. You know, we human being naturally, things they see as a threat is what they want to react to. So the fact that people are no longer dying the way they used to die, people are having this wrong notion that the epidemic is over. It's not over, because our fear is that in pandemic like this, the virus may develop variants. You know, there are various variants that are Delta variant, Omicron variant. We are not even sure whether another variant will come up. So if people don't take the vaccination, the danger that lies there is that if there's a variant that come out and become fatter, those who are unvaccinated are likely to suffer more morbidity and mortality. So we should not be carried away by that wrong perception.
And from Ondo to Taraba State, where the Primary Healthcare Development Agency is lamenting its inability to vaccinate at least 50% of the state's population due to vaccine hesitancy. According to the Executive Secretary of the agency, Dr. Minu Hassan, there is still need for more sensitization and reawakening for residents not to lower their guards, as only 10% of the state's population is vaccinated, while insisting that the strategy of using religious leaders and stakeholders for effective vaccination exercise is gaining more grounds. The agency is urging residents to come forward and be vaccinated.
Yes, people have taken the vaccine during the first, second, and now the third phase. But there are still pockets of people that are not willing now to continue taking the vaccines. So these are the remnant pockets that we need to convince for them to take, because it is only when we are succeeded in vaccinating 50% of our population that will say that yes, we are comfortable, we are protected, those that have been vaccinated and even those that have not been vaccinated. But in as much as we are only succeeding in vaccinating 10% of our people, we have a long way to go. So we want to continue to crave the indulgence of the good people of Taraba State to ensure that they come forward to take this vaccine, because it is in their own best interest, is in the best interest of all of us, and is in the best interest of the whole of the country. Because this pandemic is not only restricted to Taraba State or Nigeria, it's a global pandemic that we need to collectively contribute our quota to ensure that we fight it to the letter.
In rapidly and constantly evolving health landscape, urgent action is needed to address the challenges countries are facing, including an increasing number of COVID variants, commodity shortages, limited access to vaccines. Alongside measures taken to meet the needs of communities, support health workers, and distribute COVID-19 vaccines in these circumstances, countries must also diagnose and implement fixes for the broader weaknesses in health systems exposed by the current pandemic. And primary health care, PHC, must be central to these efforts. For joining us to talk more about this, Dr. Lalapo Ashinobi is a public health physician. He joins us here in Lagos. Welcome to the program.
Thank you very much, Millicent.
All right.
Good evening, Nigerians.
I'd like to begin. Is there a health for all policy in Nigeria?
Yes, there is a health for all policy. The Constitution says so clearly. That is the responsibility of government to provide for the health of the citizen. Unfortunately, these are part of the responsibility of the government that the citizen cannot take the government to court to enforce. So you just pray on the goodwill and your voting power to see that you put the right people who understand this concept and hope will implement them religiously.
So it's all hopes, and then this is essentially something that exists on paper, but practically?
Okay, so practically, we have to practice what we preach and put our best foot forward. And our best foot is the primary healthcare system. WHO says it, everybody knows it. So why is it called primary? I mean, if you start any journey, educational, you have to start from the primary before you go to the next level, before you go to the next level. You cannot run before you start crawling. So the primary healthcare is the closest health system to the people. And it is what everybody should hook up to understand. So like I said before, though you cannot take government to court, but you can make government responsible. And the only way you can do that is for the people to be involved in their own health system at the community level. So it starts from the home to the community to the smallest political unit in our law, which is the ward. Now, Nigeria runs what they call a ward health system. That means it is organized in every political ward within the 774 local governments. Because politically, every ward has a councillor who is at the legislative home of the local government. So they can advocate, they can even pass law, they can even pass budgets to support the primary health care at the local government level. However, because health is on the concurrent list of the Constitution, so as the local government is responsible, The state government is also responsible, and the federal government is also responsible for health. And so everybody must see the primary healthcare system as a baby to ensure that we'll be able to meet it. Look at the COVID, for example. So all these figures that you reel out every day, this number of people are tested, this number of people are vaccinated. However, for every single person who is tested, you have a minimum of 4 to 10 people who they are in contact with. And this contact need to be traced by human beings. Now, who does this tracing? Who is the foot soldier? The foot soldiers are the primary healthcare system health workers. So they get their phone numbers, they visit them at home, they provide home-based care. Now, the commissioner, one of the people on the last view, was saying that you need to sensitize religious leaders, bring them on board. Please, who will talk to all the different religious leaders in every community? It is the primary healthcare system workers. So they know every church, every school, every mosque, every traditional home. They are known in every community. Now, you must bring those community leaders together to give them a picture of what the health system is and what their role is in it.
So with the current system that we have,
yes.
primary health care,
yeah.
does it help us? Has it helped us in the past in fighting infectious diseases, yes. the pandemic?
In fact, now more than ever before, we need to now focus on that primary healthcare system. It has helped us in the past. It is failing because the governance structure around it is also failing. However, we can strengthen it. It has 4 major areas. I'm glad the vice president and this country wants to reform the health system. They just set up a health reform committee. But I'm saddened that of all the mandates, there was no specific mandate to look for, babysit, to feed the primary healthcare system so it can fulfill its pace. So that system will cater for 80 to 90% of our health problems, including common endemic and epidemic disease. So if there's something is epidemic, that means it's just coming. So COVID is a new worldwide epidemic, and that's why it's... But now, everybody is getting used to how to manage it. Everybody now knows how to wash their hands, when to keep social, how to get vaccinated. So we are learning, and so we're going to learn to live with it. Now, what are the 4 major areas that I hope and I expect the government to look at for primary healthcare system? 1 is the governance. Now, the governance we need to have for primary healthcare system is the one we call the do with, not do for, and do by. So that means you do it with the people. So the people understand what their problems are. You just need some people to help them focus on how to come together to provide a solution. So you get into a community where there is diarrhea, right? I'm sure if you tell the people and explain to them the link between poor water and poor sanitation, and teach them how to wash your hand, how to filter your water, when to drink, when not to drink, and how to take somebody to the closet, they will know what to do. You're not going to filter their water for them. You're not going to boil it for them. You're not going to tell them where to go to when they're ill. They know what to do if you not give them the information. So they come together, form like a social group, and move as a force. And they know what to do, how to help people. So that governance has to come at the ward level, so the people will take charge of their own health system. The second thing that will need to be looked at is funding. Funding is a very big part of it. Now, if the governance structure is settled, then the people will know how to mobilize resources. Then government will now bring what they need to do to complement local resources and move things forward. However, at the government level, we've turned our funding mechanism on the head. So it's a pyramid that is standing on the head, the sharp base. And you know if a pyramid is standing like it will tilt. So the part of our health system that will give the greatest funding is the specialist and tertiary care, where less than 5% of the people can go. I don't think everybody who has malaria will go to a teaching hospital, a specialist. They go to primary. So what? The funding is reversed, followed by the secondary, then the primary. So I think we need to tilt it and make the base that has the widest reach get the widest funding. Luckily, federal government has tried. They've put up something in the National Health Act that says 1% of the consolidated revenue fund should go for primary health care. So the states can replicate and the local government. So funding is a very big issue, from partners from private sector. So COVID did something very good. That's the private sector coalition for COVID. However, they focused their energy more on the very big things. So building isolation centers, bringing in medical equipment, very sophisticated. That's the specialist care.
So you think
they should just look at the primary care. Give them power, give them humans, give them ambulances, and all these things will be sorted out. Now, the third thing is we need to look at how do we use the health team and the people to ensure that they look at their own problem. The fourth thing, they have to look at the framework for accountability. So any system you put up that you do not review and is not accountable to those who set it up will now become what we call a lot of policy in the books, and we will not make results. And I know the people can do it, and Nigeria is made up of very smart people. And if they want to go, they go. And I trust us to do well.
Thank you so much. Dr. Oladapo Ashinyobe is a public health physician talking about the importance of the cornerstone of Nigeria's health policy, primary health care. Thank you so much for coming on the program. Still to come, thousands of nurses in Australia go on strike as COVID cases mount. Join us again. Welcome back. Uganda recorded 126 new infections last night with a 7-day average of 64 cases. The country's total cases between February the 1st and 14th reached almost 1,000 cases. Well, to talk more about tackling the pandemic there, Dr. Monica Musenero Masanza, Minister in charge of Science, Technology, Innovation with the Office of the President, Uganda, joins us now for more. Thank you, Doctor, for joining us on the program.
Thank you very much for having me.
All right. Doctor, give us an idea of how Uganda has survived the coronavirus pandemic.
Uganda has done quite well. We thought we would be doing very, very badly up to this point. We got our first case in March 2020 on the 21st. We went for scientifically designed measures. So we started by, we were a country that locked down before we got our first case. The rationale was that we were not prepared. We didn't have tools to help us fight, even if we had only one case. During that time, we put in place measures to help us, first going for basic tools, making sure we have hand sanitizers, we have proper information about whether masks help, and generally get the scientific information. So when you look at our first wave, which was started around March 2021, which was largely imported cases, we did not have community transmission because we restricted those imported cases because the country was not ready to mount a response, and also buying time to learn from areas where they were having a lot of cases. So during that time, we applied a lot of classic epidemiology. Most of the cases that arose were healthy people who are traveling, so we didn't have even a single death. Of course, later, we went into now the second wave that we call our second wave. And that is when we had some, we had the deaths, we had some deaths. We had, after some time and the monitoring, strictly epidemiologically monitoring our capacity, which we had built in the hospitals, we were able to waive that with very few deaths. At that time, we had less than 300 deaths in that second wave. We try to balance the hospital, the available hospital capacity with the restrictions. So when we put restrictions, we had to try and manage. Then, of course, when that wave went down, we tried to open up. We tried to open up the economy because you are trying to balance the economy with the public health. But also then we were trying to build the capacity, a capacity for treatment, opening up more treatment space, capacity for prevention. And as that took us into the second year, and as you know, by 2021, early 2021, vaccines had started appearing on the horizon. So we tried to access vaccines as quickly as possible to try and protect especially our elderly population, who were the ones who were getting very affected and dying. Access to vaccines was slow, and it also came along with a lot of anti-vaxxer messages from all over the world. However, we started some vaccination early 2021. Just like every country, we've struggled with uptake, but we have moved. We have done a lot of aggressive campaigns and communication and going to where people are. And then we had our third wave. Now, that is the Delta. Now, Delta hit us most. Our deaths rose from 10 times. Our hospital capacity almost came to being overwhelmed. Again, we had to now bring a lockdown to try and curb that, to reduce that. Now, Uganda
I want to
has a
quickly
lot of
ask,
young people. And,
Doctor, I want to quickly ask you,
Yes.
because I know that you've been, previously played leading roles in the control of Ebola, also several other epidemics in the DRC, Sierra Leone. When you think of how Africa has fought COVID, what would you say the future holds for us in fighting epidemics or pandemics like COVID-19? Briefly, if you can.
Yes, Africa should be the champion. We should, the rest of the world should be learning from us, because we have been battered by these epidemics and we have a lot of capacity on the continent. It's just that sometimes when the real situation comes, we do not deploy it. So COVID is massively has not damaged Africa the way it had been explained. But one of the things we should take from here is this is one thing Africa can share with the world. We are the ones who really know what to do with the pandemics and epidemics. And we need to get out of that corner and begin sharing this capacity, sharing this competence with the world. Secondly, Africa, we need to make sure that we are no longer dependent on tools. We needed to pick courage and start working on tools, because we are at the epicenter. This one came from out, but likely immediately this one goes down, one is going to rise from our midst. So we needed to learn, and especially in my field of science, technology, and innovation, we must make sure that Africa builds capacity, one, to make vaccines. We should be able to do research and develop vaccines. It's not very difficult. Uganda has started. We have vaccine candidates that we have, some of them have almost finished animal trials. We should be courageous. Two, we need to build the other tools. All these things that you have to go somewhere to give you PPE, to give you basic things. And Africa also needs to learn that beyond public health, epidemics are an economic tool. If you look at what was in West Africa, Ebola, there was a lot of money. So we needed to not just look at it as when you have an epidemic, you have charity, you have the world come and donate to you. We also need to look at epidemics as something that we can build industries and create jobs and also contribute to the world.
A lot to think about. We appreciate your time. Thank you so much, Dr. Monica Musanera Masanza, Minister in charge of Science Technology, Office of the President of Uganda. Thank you for joining us on the program.
Thank you for having me. Greetings to Nigerians.
Thank you. And Novak Djokovic, who says he'd rather miss out on future tennis trophies than be forced to get a COVID-19 vaccine. The world #1 told the BBC that he is not against vaccination, but he is prepared to miss Grand Slams to maintain control of what goes into his body and the right to choose. Well, in Australia, thousands of nurses have gone on strike, protesting against stagnant pay and staffing shortages. Here's more on our global COVID-19 update.
Thousands of nurses in Australia's most populous state walked off the job on Tuesday for the first time in nearly a decade to begin a 24-hour strike after talks with the government to plug staff shortages and secure a pay rise failed. Nurses and midwives across New South Wales defied a last-minute order by the State Industrial Relations Commission to call off the strike, which it says could put public health in danger.
We deserve better. We need more staff on the wards. Our patients aren't safe. Most of the time the staff are overworked and it's stressed and it's just not fair. It's not fair. We don't ask for much.
Nurses had sought a pay rise of more than 2.5% and better nurse-to-patient ratios. The strike will be staggered through the day and will include staff from more than 150 hospitals around the state.
We've been struggling. A lot of our nurses have been burnt out, doing doubles, struggling every day.
The arrival of the fast-moving Omicron variant in Australia in late November fueled a surge in COVID-19 infections, accounting for the bulk of the country's total of around 2.6 million confirmed cases and overwhelmed hospitals from more than 150 hospitals around the state.
Our website has more updates and a better understanding of the pandemic, plus other breaking stories at your fingertips. It's channelstv.com. That's our program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.